but I do want to say thank you to Dr. Herbst for everything she has done. Thank you to Cheyenne and FDRS, of course, and the Lymphedema Foundation. And those lights are very bright. So again, my name is Sarah Bramblett. I'm the board chair of the Lymphedema Advocacy Group. I am a lymphedema patient, and the reason this bill is so important to me is because I am also a Medicare beneficiary at the ripe old age of 45. Just a little bit of history. In 2014, I spoke at FDRS in Washington, D.C. That was my first trip there to lobby for the Lymphedema Treatment Act, and I was wearing this exact same shirt. I was very proud that I was able to locate this shirt because I've since moved from Ohio to Florida. And let me see if I know how to advance the slides. Yes, so disclosures. Am I the only one with disclosures today? I wasn't even sure if I needed to, but in this day and age, it's best to be safe and disclose. This was actually part of my other advocacy hat. I work and advocate for access to care for obesity also, and so this was something I did last summer. They have nothing to do with the Lymphedema Advocacy Group or the bill that was passed. I wish they did. No. So the Lymphedema Treatment Act. How many of you are familiar with it? Okay, great. So I put this slide up here because I know I hear a lot of people say, things aren't covered, lymphedema's not covered, lymphedema's aren't covered because it's not acknowledged, no one recognizes it as a disease. Now I'll admit, lymphedema, that's a little bit more true because we haven't even had a diagnosis code until recently. But it's the reason things weren't covered, and when I say things, let me be specified, this bill concerns compression garments. That's all it concerns. I'll touch on the other items in the next slide. But look at this, Lymphedema Treatment Act was the most supported healthcare bill in the past 3 sessions of Congress. Think about what you see in politics these days. We had a bipartisan supported healthcare bill. People agreed on this. So it wasn't that they didn't know about it, it's just Congress takes a long time to get things done. In July of 2022, it passed unanimously out of the E&C committee, that's the Energy and Commerce Committee. That was a huge deal. There was a very nice hearing where many co-sponsors, not just our champions, but other members of Congress spoke in positive support of this bill. And this is a little mistake. It's November of 2022. It passed in the House, the vote of 402 to 13. There are only 435 members of the House. We had 402 vote positive. And now someone recently, just today, asked a question on the app if there can be a list of who supported this. I'll tell you now, the leaders in the House were Jan Schakowsky and Buddy Carter, Earl Blumenauer and Mike Kelly. Those are the 2 leaders on the 2 committees in the House. And in the Senate, it was Maria Cantwell and Senator Chuck Grassley. But yes, I will post a list of all the co-sponsors we had, and I will even post a list of that vote so you can find out who the 13 were if you want to know. So then, the most exciting part was, in December of 2022, it passed into law as part of what you would hear, the omnibus bill, because you know it doesn't just have to pass the House, it has to pass the Senate, and then it gets signed into law. And no, there wasn't a signing ceremony. We wish there was because it was signed into law in St. Croix. So what now? So the bill is a pretty simple bill. It's less than 5 pages. It states Medicare will cover medically prescribed compression garments. Now, what about those of us, I'm on Medicare. Anyone else who's not on Medicare? You might not know, Medicare sets the standard for the other insurances to follow. So one of the reasons, some of you might have had coverage for compression and then suddenly your insurance company said, no, we're only covering cancer-related lymphedema. There was no set rules, there was no set precedents or protocols for coverage of compression, and therefore insurance companies could cover it as they wanted or as they didn't want to. So this bill fixes that. Coverage will not begin until January 1st of 2024. It does state that coverage is for standard fit and custom-made compression, and that it is for all patients with a diagnosis of lymphedema. So it doesn't matter if it's cancer-related, non-cancer-related, doesn't matter if it's primary or secondary, it doesn't matter if it's lower extremity, upper extremity, or head and neck. These are the 3 things that we specifically wanted to make sure were covered in the bill, that no patients got left out. But I'm sure with that you're thinking, but what about lymphedema? So this bill was first introduced in Congress in 2010. So I will tell you now, and it was introduced by a mother whose son was born with primary lymphedema. I hate to say it like this, but lymphedema probably wasn't on the radar at that time. And as, of course, especially when I joined, I do have a secondary diagnosis of lymphedema, as most, I'm sure a lot of patients do. I know there are a lot of patients don't. But right now, it is patients with a secondary diagnosis of lymphedema would be able to get covered. It hasn't been added, so when you're passing something through Congress, it took a lot of research, a lot of documentation to show why these were medically necessary for lymphedema patients. That information just doesn't quite exist yet in the lymphedema field. As you saw this morning, though, they're working on it, and that's a great thing. Another question I got, what about surgery? So the reason the Lymphedema Treatment Act was needed is because there was no Medicare coverage. The reason there wasn't Medicare coverage for compression garments is because Medicare is a defined benefit category payer. So all of their categories have a description, a definition. So most patients would think it's durable medical equipment, but Medicare defines durable as 2 to 3 years, sometimes 5 years, depending on what the equipment is. So compression doesn't fit under that because we need compression every 6 months. We asked CMS if they could change things, they wouldn't. So that's why the bill, it took an act of Congress. So when it comes to surgery, we don't need an act of Congress to cover surgery because it's already covered under your medical services. Is it covered well? No, but it doesn't take an act of Congress. We wouldn't need to have had that in the bill. Same for compression pumps. Compression pumps technically are covered. There's a whole Medicare memo on the coverage. Are they covered well? Can everyone get access to compression pumps? No. But there is a benefit category for it. It doesn't take an act of Congress to get that coverage approved. And the same with the manual lymphatic drainage. It's under your physical therapy or occupational therapy benefits. Now, of course, we need to improve all this. It just doesn't take an act of Congress, so that's why it wasn't included in the bill. So what now? So again, CMS has 1 year, not even that long now, to implement this coverage. Coverage is no good if it doesn't actually cover what we need. So we have been having stakeholder listening sessions with CMS. They have a whole staff team dedicated to developing what they call the rulemaking process, which will be the details of coverage. These are a list of stakeholders so far that have had meetings. I'm pretty sure all of them already had their meetings. And so they have, as you can see, we have the patient advocacy, we have several other organizations, and we also have the clinicians included in there too. So again, what now? So the rulemaking process, CMS is getting all this information, learning more about compression. We've tried to educate. This is everything that we gave Congress and like this Congressional Budget Office about pricing and everything, that doesn't automatically get sent over to CMS. So we didn't have to start fresh because we've met with CMS about getting this coverage before, but they are doing the research. This is a list of things that we wanted to make sure, and as part of the Lymphedema Advocacy Group, we told CMS is important to us. Allowable quantities. So most people say, oh, you need 2 garments every 6 months. How many people have heard that? 2 garments every 6 months, 1 to wash, 1 to wear. Okay, well, I wear knee-high, so that's technically 2 garments. I actually should wear capris. That's 3 garments. Technically, I should have arm sleeves. That's going to be 5 garments. So we want to make sure it's not garments, it's sets. However many sets a patient needs, and the patient needs at least 2 sets of garments every 6 months. So that's the replacement frequency. We want to say, oh, we'll give you 6 sets at the beginning of the year because you need them every 6 months. What if your measurements change? Or we also want to make sure if there's someone who, for some reason, has an occupation or there's a big fluctuation in their size, either up or down, that they can get replacements sooner than that if needed. So there's some type of process for that. The next one is very important to me, and I know is very important to a lot of lymphedema patients who are late stage or who need the flat knit garments. Access to custom-made supplies and compressions. Now, of course, the bill says they must be covered, but we want to make sure that they don't put some type of burdensome, pre-authorization or in there that would prevent us from getting what we need or slow down the process for getting what we need. Because anyone who's like gone through the reduction phase and gets ordered for garments, you want to make sure you get those garments in as soon as possible before you lose any of your progress. Vendors and reimbursement rates. Most of you also know there's probably not very many vendors. Reimbursement rates vary because there's been no set reimbursements from Medicare. We let Medicare know reimbursements may have to be enough for vendors to want to supply these and to accept Medicare for these garments. So we can't undercut the reimbursement rates. We're aware there's some states that have passed mandates, and we're aware there's some insurance companies who have put a cap on custom garments so low and so under the cost of the actual garments that patients aren't able to get their custom-made compression. And then the last one is coordination of care with other Medicare services. Patients don't only go to outpatient clinics for their lymphedema treatment. Some patients might be able to get lymphedema treatment through home care, which I hope that would improve. Patients might be in a skilled nursing facility or long-term care facility, or even when they're in the hospital, maybe right after surgery or something. So we just want to make sure that this benefit category that's being created under Medicare Part B coordinates well with the other benefits, and that they're able to get the compression that they need in the setting that they're in. So what's next also? Someone also asked this as a question. CMS will publish their proposed rule, and there'll be a 60-day public comment session. We were told it'll be mid-year, so we're looking June, July. The quality of the comments is more important than the quantity. In the past, we've given templates for people to just sign their name. They could add something, just sign their name and send it to the members of Congress, and it was basically the same message. That's not the type of thing that'll be beneficial with CMS. We need people to actually compose comments and give their personal story as to why they agree or disagree with the comments. It's hard to tell, for me to tell you what to put right now, because we don't know what the proposed rule will say. But let me tell you, at the time, we will make sure we give everyone a how-to, to put those comments in and what to put. One of the things we anticipate is really if anyone's had issues getting their custom-made compression, and depending on what the rule says regarding that, we need to really share and make sure they know how important it is that we have access to custom-made. Okay, so what's next? So how can we improve lymphedema care? So I wanted to add, there is a portion of the bill that states that the Secretary of Health and Human Services, who runs CMS, has the authority to make any changes as they deemed necessary to coverage. So that is the opportunity for, as we get more research about lymphedema, as we get more research, was it Dr. Wright and his team was doing compression research. So not just that compression is, prevents progression of lymphedema, but it actually is helping treat it. So we get more information. We can go to CMS and say, hey, can you change this? And that's the possibility of having just a lymphedema diagnosis being able to be covered by compression. But it's going to take more research in those conversations. And that is the same for surgery, pumps, and MLD, under your rehab. So these issues that exist, we're well aware they exist. We just have to have the information to go and convince them to, expand the coverage. And appeal. Everyone who has insurance and you're having issues, fight back, appeal. The more you appeal, the more the insurance companies are going to get a message. And just as the surgeons have mentioned, they have been educating insurance companies and improving coverage for liposuction surgeries. That's what we need. We need not just the surgeons and the providers to be advocating with the insurance companies. We need the patients themselves to call that number on the back of your benefits card and let them know. Call your HR or whoever provides your benefits for you. If you're on Medicaid or Medicare, call your state representative, call your U.S. congressman. We're paying and they're paying for our coverage. We need the care that we need. And that's the good thing. Regulatory changes are quicker than legislative changes. Not as quick, but at least semi-quicker. But we also need, as I said, we need more surgical care. We need more home care. How many people have lower extremity issues? How many people have driven while wrapped? It's not safe. It's not good. How many people have walked out from the clinic and your wraps have been down to your knees or your ankles before you even get in the car? Thank you. That's available out there, but there's not enough. But we need, more access to home care for us. We need more inpatient care. I heard Cheyenne maybe correct me a few years ago. That was one of the hot topics at the provider roundtable, was inpatient care for late-stage lymphedema patients. We need that. We need accessible equipment also. I know there was mention of a DEXA scan. I know there is some mention of MRIs for being diagnostic tools. Someone my size might not be able to get those tests because they have a weight capacity limit. So there's just things outside of even the treatment for our lymphedema versus the treatment of all of our healthcare needs that we need to improve. And it will take this type of advocacy and changes to some of maybe the regulatory protocols and guidelines to do that. But we need to be able to identify those barriers until we can effectively address them. So like a lot of people said, oh, lymphedema compression aren't covered for XYZ. No, we actually found out why they're not covered, and then we addressed that issue. So with some of this, we need to identify the barriers so that we can overcome them. So here's my contact information. If you want to sign up for our newsletter, there's our website. It's down in the lower left-hand corner. And again, you will get an email letting you know when that public comment session is open and how to submit public comments. And I have a few minutes left. I think I answered most of the questions, but if there are more, let me know.
You answered the vast majority of the questions that were applicable for this session. I first just want to thank Sarah and thank everyone on the Lymphedema Treatment Act, because this is a huge accomplishment.
It's a BFD. But it's certainly not just me. We do have a team of grassroots volunteers. We're an all-volunteer organization, as FDRS is, and it's just been, it's been an amazing ride, but
a labor of love.
Yeah, of life, really. I mean, I tell people, fight like your life depends on it, and that's honestly how I felt. There's been several times I've been walking the halls of Congress with just coming off antibiotics or being currently on antibiotics for cellulitis. But I will tell you, those staff members do listen. They do care. There are staff members who, when we said, are you familiar with lymphedema? They said, one young man said, yes, my mother had it. I used to help her wrap her legs. There's at least 2 staffers who disclosed to us they had lymphedema themselves. And I don't know, are people aware of the big political figure that there's rumors to have lymphedema? I won't say the name if you don't know it, but yeah. But so it's not a lack of knowledge or understanding. Sometimes it's just they have so many healthcare issues coming to their office. They have so many people reaching out to them. We have to be the squeaky wheel and stay on top of things. So
Well, I'll ask a question.
Okay.
What can we as a lymphedema community do to now take the work that's been done with the Lymphedema Treatment Act and expand it to other areas? You mentioned some research, but how do we as an organization, even an organization and a community, do something similar to what the Lymphedema Treatment Act has done?
So I think, like I mentioned, we need to identify what the barriers really are. So like there is a surgical, of course, coverage for, say, Medicare insurances. Are they denying it because they're saying it's experimental, or what's the denial process? Do we need to possibly hold some type of meeting with CMS to get, like the compression pumps have a coverage memo and a coverage guidelines. I know some of the insurance companies now have coverage guidelines. Maybe we need to meet with CMS and get that type of coverage guidelines out there. I mean, I know there's Medicare patients who've had surgery covered. Some might have been an Advantage plan or not, but those types of conversations we are had. And now that the bill is passed, and once everything's implemented, and please know, January 1st, 2024, it's not just going to be like magical coverage and you're going to be able to get your garments. There's most likely going to be some things to work out even with that, and we're prepared for it. But it's a huge step, and I hope with this coverage, I hope it improves the care patients are getting. I hope it encourages more clinics to treat lymphedema, and that patients are able, right now you wouldn't be able to get a pump if you hadn't failed at having compression, and if you can't afford compression, you can't fail at it. So I'm just hoping this really is the catalyst to improve overall treatment.
Thank you so much, Sarah.
Thank you.